right, so first I want to introduce myself. My name is Jules E. Capon. Everyone calls me Jules. I am a licensed psychotherapist, and I have my own practice in the DC area. And I've been a patient of Dr. Jemsek's for several years, and he has gotten me so much better. I won't even go into the backstory of how sick I was, but he has, changed my life in many ways. Quick story. So when I was very sick with Lyme, I was trying to find a therapist that specialized in Lyme, and I couldn't really find one. It's kind of a very specialized area. So that kind of made me want to shift my practice from working with people with just anxiety and depression to more working with Lyme patients, because I feel like I just have such a true understanding of what Lyme disease is, what it feels like. So my practice is mainly geared towards working with Lyme patients now. I work with them all over the country, mainly virtual. There's a few in the DC area that I can see in person, but yeah, mainly virtual. And I do a weekly support group, a free weekly support group called On Lyme, and it's every Tuesday evening from 6:45 to 8. So I can give you more information about that if you guys want to contact me. And then I'm really excited to be here to host this live stream for the connection between Lyme disease and mental health. A lot of the questions will be directed toward Dr. Jemsek, but I'm going to answer a few as well. So first, Dr. Jemsek has a few things to say, and then we'll get started.
Thank you, Jules. So we're thrilled to have Jules here. She's an indomitable spirit and workaholic. No, she is. I mean, she'll be sick and say, I got to do my work. So, but she's very knowledgeable, and I thought she'd be a natural here. And I think she will. And she has a tremendous following on Instagram, I understand, way more than we do. So she's very popular and very helpful. It's glad to have you here, Jules. So I wanted to show you guys, and I really appreciate the following that we have, and I'm trying to educate and answer questions. And I just wanted to, I know you like personal interest things and like my piano playing and all that. This beautiful handmade rosary was given to me as a gift by a new patient last week, so I can't really say the name. Isn't that beautiful? And believe it or not, I know I'm irascible sometimes, but I was an altar boy. And believe it or not. And then I'm going to put this in the front of the clinic. I'm going to stand up with this, and Jules is going to help me. Mm-hmm. So this is a wind song. Everybody see these beautiful colors? I have trouble with colors, so we're going to walk through this because I want you to read it out. And I'll try. So we're starting with what, the emerald?
Okay.
Yeah, this is emerald, right?
If you guys want to see this.
This is emerald.
It starts with emerald, and the color means the darkest days of Lyme disease. So emerald.
Mm-hmm. And what's the next one?
The next one is chartreuse.
Chartreuse. Chartreuse.
Never heard of that color before.
This is chartreuse.
No, that is turquoise.
Wait. That's turquoise. This is chartreuse. See, I told you I wasn't very good.
This one.
This is chartreuse.
No, this one. Yeah.
Yeah, they're the same.
That one means...
We're both right.
That one means starting the Jemsek protocol. And then we have light lime, which is that one. And that means progressively getting better. And then we have light blue and true blue, which means promised blue sky days, which we all want.
So everybody knows what blue sky days are, right?
It's the days where we feel healthy.
Where you feel alive again,
yes.
And you're not in a torture chamber.
And the last one is diamond turquoise. And this means, Dr. J, you are the diamond, the gem, you are the harmony. So sweet. I almost cried when I heard that.
And this is from Lana and Dan Carnival in Mount Pleasant, South Carolina. Patients for 2 or 3 years. And I believe it was Lana's inspiration, and she came up with, this postcard and this windsock. I'm going to hang it in the front of the clinic with a plaque. I'm going to frame this card, which goes through the colors. So I wanted to share that with you. Yes. I just think it's really pretty cool.
And if you want more information on that or want to get one for yourself, you can email ribbon, RIBBON, windsocks, WINDSOCKS @gmail.com.
So we're going to answer a number of questions, and feel free to stream them in, and we'll try to select the ones that we can get to. And Jules is going to be monitoring that because she's millennial and she can do those things and I can't. So you noticed I work usually with young women who know how to handle the computer because I don't. But I just wanted to start by expressing my thanks for your attention and your enthusiasm following. I know we have a few thousand people following and lots of shares, and we will never run out of information to tell you and talk about. This disease is so vastly complex. That's not an exaggeration. It involves virtually every system in the body, and there's never been a disease like Lyme borreliosis complex that so efficiently attacks virtually every part, well, not virtually, essentially every part of the central nervous system and the peripheral nervous system. And Livingood showed this. Dr. Livingood at the Institute of Allergy and Infectious Diseases in Fort Collins, I think in 2006, she did cell cultures and took their regular laboratory spirochete, B31, overlaid it on all the cells, the support cells, the neurons, the glial cells, etc. And every single cell got invaded by the spirochetes. Every single cell. It's just frightening. And unfortunately with this disease, if you have an infected neuron or support cell, that's a dead cell. And, if it can be replaced, it should be replaced. But a lot of what happens is that the priority is to eradicate the infection so the body can heal. And so a lot of therapies don't grasp that. And they're all slow growing, these targets, and they're multiple targets. And so it's a process. It takes a while. It's like treating tuberculosis, not an abscess in the elbow, where the bacteria are multiplying, every 30 minutes. These targets, without exception, including Babesia, Bartonella, Mycoplasma, Chlamydia, Proteomyxoma, Candida species, the replication cycles are very long. So you have to be very patient. And at any rate, I kind of got off track there. This is about, I'm sorry. I hope that was useful anyway, somewhat. But I wanted to say a few words about thanking everyone. I know there are people in the audience who are watching with ill intent and would like to harm the message. And we're going to ignore that. We're never going to stop telling what we think is the truth. I think medicine has to change. And if 5% of us out there are advocating, that's how medicine changes, folks. The mainstream's not going to change all of a sudden. And as long as we practice safe medicine and put the patient first and do things one at a time and have plausible hypotheses that we follow to the end, then we make progress. And that's what we're about. So I know there are people out there that don't wish us well. In fact, worse than that, but we'll tolerate you. And we hope you change your mind. We know you probably won't, but it's not going to change us. So thank you very much.
All right, so now we are going to get to some of the mental health questions. At the end, if we have time, we're going to go over questions that we didn't get to answer at the last live stream. But we'll go ahead and start with the first mental health question, which is, what can I do to help with anxiety when thinking about my future with Lyme disease? That is a very, very, very common question, because who wouldn't be anxious finding out they have an illness and they don't know what the future holds? It would almost be weird if you didn't have anxiety about that. So first, I like to normalize that feeling of being anxious. I was very anxious when I got my Lyme diagnosis. I didn't know what was ahead of me. So normalizing that most people feel that way. You're not alone in that. The second part is acceptance. And I'm not saying accept that you're going to be sick for the rest of your life, but accept that you have this illness and there are things that you can do to get better. And so we get stuck in the anger phase of, why me? I'm going to be sick forever. This sucks. And I get that. It's all normal, but we have to move on from that. It can become very counterproductive. So the acceptance part is really, really huge. And then I would say the last part is the coping skills, because when we start to feel that, anger or stress, we need something to distract our minds. So whatever it may be, painting, writing, walking, positive thinking, relaxation exercises. It looks different for everyone, but you almost got to force yourself to do it. And then I can go on and on forever, but I think the 3 most important things for helping with anxiety, thinking about Lyme disease, is normalizing your feelings, accepting it, and learning to cope with it. Do you have anything else?
Just that you need a support person and somebody that understands is with you on this journey. Because it's easy to get lost when you're the one inside looking out. But those were excellent points.
All right, so this question is for Dr. Jemsek. How do you handle mood swings brought on by Herc's reactions?
So we try to prepare our patients ahead of time so that they're buffered and they have tools that benefit them. So a lot of people come to us already educated and already knowing about dietary modifications, lifestyle modifications, requirements for extra sleep, mood stabilization. Many people come to us on medications that may or may not be working quite well. So we start slowly, whether it's an oral program, which is 80% of our practice, or an intravenous program, which is 20%. And in our intravenous program, and they're both about 9 to 12 months long. Well, the IV is about 8 or 9 months, but then followed by oral. So it's a year, let's say. And it's 8 or 9 treatment days a month. And prior to getting into that, if you look at our website, the first step is a stabilization. So we stabilize core essential life functions. And a long time ago I said essential life functions, and we have an ELF, E-L-F. And on several of my slides, I get a little elf that's animated that walks across the slide. And so anyway, POEMS, P-O-E-M-S. So pain, other, which means support. E is for endocrine, so the cortisol axis is particularly critical, but also sex hormones. So if you don't have any testosterone, that can definitely affect your brain function, overall vitality. Thyroid disease is extraordinarily common and needs to be, it's easily handled, quite honestly. And M is for mood. That has to be, you have to have our patients with us on the reservation. They can't be jumping outside off the reservation. So we'll work with a psychiatrist, psychologist, or we're very comfortable using neurotropics and psychotropics to stabilize our patients. And then the last one is S for sleep. So important. We need our deep sleep. Oh my gosh, we have to have it. That's when the brain rinses, it's when it's restored. If you go to TED's talks, you'll see some of the talks about how the brain rinses at night during deep sleep. We don't have a lymphatic system in our brain. Well, actually we do. It's a tiny little group of lymphatic chains on the vertex right here. This is your vertex, but not really. So the rest of the organs in the body have lymphatics that carry waste away. So the brain needs to rinse at night. Otherwise, you carry the toxins over. We also are well schooled in neuroprotective supplements. So when you Hercs, we want you to stay, like I said, on the reservation. I have lots of metaphors. We're metaphor kings here, I guess, and kings and queens. But we just try to tell the story back to you in a way that sort of makes sense. We need you on the reservation. If you're bouncing out because you're Herxing, then that's too much. We need to back down, or we need to say, okay, are you doing the right thing? So for example, I've found a lot of people taking sweeteners on off days when they're not supposed to, and we try to emphasize that because sweeteners that we use, the sugar alcohols break down the biofilm. That's what we use, and it has to be done in a certain synchronized way. So with this extremely complex illness, there are at least 24 modifiers that can consternate care or, preclude care, quite honestly, until they're fixed. But just back to the specific question about a Herxheimer, it should be manageable, and the well-schooled patient will know how to detox and double down on the detox. So that's being careful of the diet, that's taking your antioxidants, and that's trying to sweat, whether it's passive or active. And then, all the mood issues, et cetera, come into it. You may need more anxiolytics, and we can talk about that later. Jules can talk about that later, about the cannabinoids and the Ativans of the world. So, right, thank you.
All right, this question is also one that I get probably every single day. So here it is. Is there a psychological basis for Lyme rage, and how can I explain it to family or friends that it really feels like it's out of my control?
Right. So the edit buttons go rolling down the street. You lose your editing, and you just flare. And what's happening is the amygdala is so hot. And the amygdala is, I call the devil gland. It's the bottom of the brain and limbic system, where else? And it is our anger, fight or flight, inducing organ, which usually is in symbiosis, checks and balances with the prefrontal cortex. Prefrontal cortex is our awareness and helps us say, okay, why am I, if you get frightened or startled, well, for example, this door behind me is closed. And if I had a brain on fire with the amygdala, with the double gland just firing away, somebody opened the door suddenly, I'd probably jump out of the chair. That's a startle reflex that I would have. It's involuntary. But if somebody opened the door now, I'd say, hey, we're filming, get the hell out of here. So, because my prefrontal cortex is able to process and organize and say, there's nothing to be afraid of. There's nobody with intruder. There's no harm here. It's just somebody opened the door by mistake. And so that's just one simple example. We use medications to try to calm down that hot area in the brain because, to some extent, without dulling the patient or without making them feel they're drugged. So there's an art to that, and we're very used to that. But I think it's essential to stabilize patients prior to therapy.
Okay, the next question is, can Lyme disease cause PTSD? And I'm going to say absolutely. The main thing that me and my patients talk about, we kind of call it medical trauma, because most people's Lyme disease, it takes years and years, not always, but most of the time, to get diagnosed. They've probably been to 10, 15, 20 doctors. They might have gotten misdiagnosed, been treated for something they don't have, or most commonly, doctors tell them it's all in their head or it's psychosomatic. And now more than ever, I feel like I'm hearing stories of doctors being extremely cruel to Lyme patients and not believing in them or just shutting them down. I had a horrible experience when I went to a doctor and I couldn't walk. My legs were still semi-paralyzed, and the doctor said, well, you're young and, you're young and pretty or something, so you'll be okay. And I walked out crying. And I just hear this story over and over again that my patients leave doctors' offices crying because they are offered no help, especially when they utter the word Lyme disease to certain doctors. Doctors just shut you down. So, like I said, I call that medical trauma, and patients have actually developed phobias going to different doctors. And so I would say that is the biggest cause of trauma. I don't know if Dr. Jemsek, you have some other words to say about that.
I just feel so badly for our profession, my profession of medicine, which should be the most noble profession there is, but it's not anymore. So why do doctors react in that way? They didn't do this 15 or 20 years ago. This never happened until recently, and I think that there are a number of doctors who shouldn't be in medicine in the first place because they don't have the compassion. I realize there are pressures brought on by the overlords, who are the insurance companies and hospitals, to see 4 people in 1 hour, 7 hours a day. I get that. It's not right. And that's not good medicine. Doctors therefore put up a big shield, I think, and are fearful of something they don't understand, which is Lyme disease. And to them, I'm afraid it's going to be like Chinese water torture, drip, drip, drip. It's not going away. They're going to keep hearing it. But I apologize on behalf of my profession for the behavior, which is unprofessional. And I would just say a lot of my patients are pushing back and just giving it right back to the doctor. But, you know what I would say? I would say, doctor, I'm very disappointed in your behavior. It's highly unprofessional. We won't be back. And that's what I would say.
Or if doctors would just own up and say, you know what, I don't know what's going on with you.
Wow, yeah.
Instead of blaming it on a psychological issue or saying it's psychosomatic. I would respect a doctor so much more if they just came in and said, you know what, I don't know what's wrong with you. And I'm sure a lot of people would agree with me on that. Next question, also relating to some mental health, is OCD related to Lyme disease? And if so, how is the best way to help that?
Well, I think without question it's related. It's particularly common in I'm blocking. What's the disorder in children? Pandas. Pandas, yeah. So it's particularly common there, and I don't really think there's a strep infection going on. And I met, is it Dr. O'Connell out of Oklahoma? Anyway, I met her at a conference, and she's a lovely lady. And, I think it's real, but I think it's in the spectrum of tick-borne illness. I really do. I think it's just a genetically predisposing thing. I think that the cingulate gyrus, which sits at the top of the limbic system, the thalamus, which sits in the middle of the limbic system up high, and parts of the cortex are all looping and creating this OCD type behavior, which is characteristic for Panda, but it's not exclusive to Panda. I mean, certainly many of our adult patients have OCD. So look, it's a little tricky to treat, but it can be controlled, I think, relatively well. So what you have to know about this illness is the brain's inflamed. And it loves the limbic system, it loves the upper cervical cord and cervical roots and so forth, and the brainstem, excuse me. Without a doubt, it's so 100% everyone, it's like building a pyramid. Everyone is irritable, 100%. 100%. Irritable.
Agreed.
They're irritable. Everyone is irritable. They're irritable. And so then it builds, a little anxiety, a little panic, a little depression, little back and forth mood, and then a little OCD and a little paranoia and a little psychosis and a little out of body and delusions, and then just frank raging psychosis can occur. So you can see the gamut of neuropsychiatric disorders. And again, we have to have those under some semblance of control before we even start therapy. And we have rules, we have check boxes, which I've gone over. And but anyway, as far as, oh my gosh, she has this anxiety. Well, I'll go back to the amygdala. It's burning brightly, and it's fueling anxiety, and you don't know why. I mean, there's no reason for you to be anxious, right? But it's involuntary, and so we have to control it with GABA drugs or CBDs or sometimes antihistamines or combinations.
And the next question for Dr. Jemsek is, how does mast cell activation play a part in mental health symptoms?
Well, I think, so histamine is an activating excitatory molecule, as is glutamate, as is norepinephrine. And to some extent, yes, serotonin for sure is activating, dopamine. It's more of a pleasure center and also has motor responsibilities. But to the extent that histamine is activating, so when we take Benadryl, a lot of us get sleepy, right? Because it's an antihistamine that crosses the blood-brain barrier. And so when you have, quote, mast cell, I want to make the point here that I know that everybody's is very fattish, and it's out there. Very, very few people have mast cell syndrome. It's just, extremely few. A lot of people have mast cell activation. And the way we know that is because we can see it, and we can't see IL-2, IL-1, TNF, IL-6. We can't see the other pro-inflammatory cytokines, but they're out there, and they're active, and they're being pro-inflammatory. Histamine, which is pro-inflammatory in excess, made in the gut, we can see because we can see dermatographism, which is a red streak on placing your finger down someone's skin, down their back, for example, anywhere in the body really, or hives, or the itching, or their unusual sneezing, and so forth. So we can see the histamine, and to the extent we can block the histamine with some very simple approaches, whether or not we use mast cell inhibition per se, or whether we just block the histamine receptors, or whether we break down histamine with DAO, to the extent that we can do that, we've lowered the inflammatory quotient, the patient feels better. So if you say, can mast cell, i.e. histamine excess, create irritability in the brain, the answer is yes, but it's something that is relatively easy to control in my view.
Okay, next question, does stress affect healing? Yes. Stress affects the immune system, and with Lyme disease, as we all know, the immune system needs to be up to par, working well, so constant chronic stress will not allow that to happen. So things like toxic environments, if you're in a relationship that, the spouse doesn't support you, or, if your family, doesn't believe you, doesn't understand the illness, that is constant stress, right? You're living in an environment where you feel like you have to always explain yourself, or explain what these symptoms are, on top of trying to heal. So that definitely delays healing. Stress of work, taking on responsibilities that you can't do. You have to listen to your body. And the biggest thing is people learning to say no. So not going to that social event, or not working that extra hour during the day. It's really hard for people to say no, especially people who are used to being very active and very involved with work. But stress is going to inhibit healing. And I have a problem with that too. As Dr. Jemsek say, I work a lot, and I probably would have healed a little bit more earlier if I had listened to him, but you just have to make changes in your life. So listening to your body is my biggest advice. If you feel like it's too much, it is too much. You have anything to add about stress?
I would say that sometimes it's more stressful for people not to work. And,
yes,
and
true.
So there's a fine line there, and we really have to have a heart-to-heart about that. So, okay, if you go to work 4 hours a day and you're not really, nobody's, pounding on you, and you're not overly stressed at work, and you feel better for working instead of sitting at home, then okay, but just do it. You have to
listen to your body.
Listen to your body and fine-tune the situation. But some people, honestly, many people are like that. I've got to go to work. I just feel useless. And okay, go for a short time, as long as you're not getting hassled by the boss, or if you are the boss, just don't delegate, please. And so there is that back and forth. I'm not sure what you would call that, but that's interesting.
Yeah. All right, another really, really, really common question I get all the time is, why do some people with Lyme respond very poorly to psych meds? So
actually, that's a good sign that there's an organic encephalopathy and the brain's on fire. And the astute psychiatrist will pick up on that. They'll say, well, my Lexapro didn't work, or my Celexa didn't work, or my Effexor didn't work, and Ptsd didn't work, and so what happens is the brain really does get damaged, and in the neuronal tracts they get damaged, but also the receptors get damaged. So the dopamine receptors, the acetylcholine receptors, the serotonin receptors, the glutamate receptors, they can all be damaged. And so that it can't take up that neurotransmitter that's important in that functioning in that limbic area to help with mood and awareness and the proper levels of excitation. So, and some people are overly sensitive to even low doses, so it becomes a bit of a struggle. Usually you can find 1 or 2 medications the patient will take, but we have patients that are intolerant of 20 20 different things that they've tried with other physicians. And it is a challenge because they still have the inflammatory stuff going on. They still have the anxiety. And the two inhibitory channels that we have are the benzodiazepines, the GABA receptors, and now we know for 20 years we have cannabinoid receptors, so that's your CBD, which is an emerging industry, needs a lot more study, a lot more science, but we do find it helpful as far as anxiolytic, and it helps actually helps us reduce some of the neurotropics that we use to help to stabilize mood and so forth. And also spares the benzos to some extent. Right, so the brain's receptors, I think, are damaged, and it takes many months for those to improve. But it is important to stabilize them as we're going through therapy.
So a question just came in, and it said, what are your thoughts on medical marijuana to help with anxiety and depression if psych meds do not work?
Yeah, I'm all for it. If it's a approved state and they go to a dispensary, I typically, I'm not crazy about vaping or smoking, but some people do it that way. There are gummies and other things. THC has been around for a long time as synthetic THC. It's level 3 used, it's Marinol, Dronabinol, and I use it all the time. I use it with my AIDS patients because it helps with regional pain. So one of the worst pain that our patients have, and many have it, is regional or central pain. That's don't touch me pain. Mm-hmm. And clearly THC is the go-to there. And there's THC creams that you can get that help as a local thing, or we use Marinol. I would say it's about 60, 70 to 40 or 30 in terms of people preferring marijuana from a dispensary over Marinol. But so I'm all for it as long as it's properly handled. And I tell the patients, it's not habituating. Now there may be some CNS effects that are being reported now, but I don't know if that's an overreaction or whether the science really supports that. But it's nothing in excess, obviously.
Mm-hmm. And another question relating to this, well, somewhat relating to this, is benzos are the only thing that will give me relief for neurological symptoms of Lyme. Why is that?
So the benzo is in checks and balances with the excitatory amines and the neurotransmitters in the body. And if your brain is damaged to the extent that, or it's just excitatory because of all the inflammation that's going on, you don't have enough benzo to counter that, to neutralize that. Or the benzo receptors are damaged, so it takes more and more benzos. As I said, CBDs may be an alternative. Sometimes antihistamines, hydroxyzine, are an alternative. We do try to use over-the-counter things, but obviously they're over-the-counter for a reason. And so there are sprays, GABA sprays with theanine and over-the-counter GABA, and herbs that tend to help and relax. But the reason that you're responding only to benzos, assuming you haven't tried some of these other things, because your brain needs the GABA. And in fact, I'll tell patients who are reluctant to take it, I'm so sorry, it is habituating, but we can get you off of it. Right now, your brain's on fire, and we need to throw some up, 2 or 3 times a day for that brain, and without you feeling sedated. So the trick is, finding which of the benzos works the best. Now they all, by the way, there's a group of them, and I use 3 of them. I don't like the rest of them too much. So I use Valium, Klonopin, and Ativan. Ativan they're all, I think, equivalent. Klonopin's got a longer half-life. Valium's good for dystonia. I think it's the best. Ativan's the best for seizures if you want to use that as a benzo adjunct, and Klonopin's probably the best for sleep induction.
Yes, Ativan has been my savior for seizures. Me and Dr. Jemsek jokes. He wants me to take it, a few times a day because it will help with my seizures, and sometimes I don't listen to him, and I pay for it. So I'm working on that. I just also want to thank you guys for sending in questions. They've been really good, so keep sending them in if you have some. But the next question we have is it possible for mental illness caused by Lyme to go away once you're in remission, or do the mental health symptoms tend to linger?
The truth is they can linger because our first purpose is, after stabilizing the patient, is get them through the treatment and eradicate the infections. Now, most times, and we're using, they're living a low inflammatory lifestyle, diet and activity. And as you get better, you can start to exercise and do proactive sweating. So sweat and get rid of toxins. And many patients are on a mild mood elevator from us or from somewhere else. We don't use narcotics, ever. We'll use topical creams to help with pain and so forth. But here's the sad truth is that after treatment, you think about a scorched earth sort of thing. Your brain's trying to heal, it finally can heal, but healing takes energy, takes time. And so you may end up being more depressed after treatment than you were at the beginning of treatment. But that doesn't mean treatment failed. It just means that we have to support you until such time your brain can heal.
Great. Next question is, my support system does not understand my illness. How do I communicate with them in a way they will understand? So this is a question I deal with every single day. And I'm a true believer that it is extremely hard to understand the illness unless you have had it yourself. So my biggest piece of advice is, whoever is your support system, your parent, your friend, your spouse, get them involved in your medical treatment. Bring them to doctor's appointments. Have them, do some research on what Lyme is. Again, be involved in the treatment, because they're never going to know what you're feeling inside. It's impossible. So they need to be educated in the best way possible, and be educated in how they can support you. So, family therapy can be really, really helpful in terms of, understanding some of these dynamics, because it's not easy for the spouse or the support system, whoever your support person is. They will never understand what you're feeling, and you will never understand what it's like for us, them being the caregiver. So there's just a huge, the dynamic between patient and caregiver is really, really, really hard. So again, my biggest piece of advice is education, being involved with treatment, bringing them to doctor's appointments, getting therapeutic help if you need it. And I'm sure, Dr. Jemsek, you get this all the time, where some spouses or family members are not on board with treatment or just do not understand the illness, because it is an invisible illness. And oftentimes people say, but you look great. Well, I don't feel great. Or, well, you had a good day yesterday. Why are you sick today? This treatment, this disease is not linear. You can have a good day or a good week and then crash and have a bad day. So again, someone not understanding that can look at it like, okay, is this person really sick? What's going on here? What are your thoughts?
My thoughts are that we need to bring you back sometime and talk about relationships. That's a whole paper and a whole subject of, there are so many things that I like to do and want to do and can see that need to be done. It's kind of frustrating. Show me the money and bring me some people. Send me lots and lots of money. I'm just kidding. But no, there's so many things to be studied, and this is one huge area where we need a couples therapist or a sociologist or something, because all the dynamics between people that occur every single day, millions of times, in somebody that's a caregiver and somebody that's dependent. And that is extraordinarily common in our population, of course, and it was with HIV/AIDS. So I've seen it for many, many years now. And I'll just give you one quick example of how complex it is. And I don't know how many categories there should be, but probably at least half a dozen. Here's one. So a caregiver, let's say a husband, is outwardly very supportive and of their wife who's in a wheelchair and, can't do much. He has to do everything for her. Maybe they got 2 kids at home. He's had to cut back on his job. He's got to take care of the kids, got to take care of the house. He has to hire somebody. And so she comes in, over time, and then gets better. And one day, one of my favorite things is when, hey, Dr. Jemsek, we have something to show you. And this person will stand out of a wheelchair and just walk over and give me a hug. I love that. Oh, that's a happy day, and that happens. That's happened a lot. So, and that patient gets better, 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 and then guess what? The husband leaves and says, "The hell with you! I'm tired with you. I've devoted all this time to you, and you to the hell with you. I hate you, and I'm gone." And I think it's right. Am I right?
Yes.
So it's like he doesn't have to feel guilty anymore, because she's on her own, and yeah, I'm through with that. And so that's just one example. There are many others. There are many loving, and devoted examples I saw in my HIV population and in this population. But that's another example. That's in our toxic relationship category. And I'm pretty naive about stuff, and I usually miss that. I've been fooled so many times. I'm just so naive. I just want everybody to be nice, and so it doesn't work like that. But that's such a fascinating subject that needs to be explored and written about.
Absolutely. And again, because if you don't have a good relationship with your spouse, partner, whoever it may be, healing just is really hard. So whoever submitted that question, that was a good one. All right, Dr. Jemsek.
Over there? Anything up there?
Anything up here? Just thanking you for answering these questions.
Yeah, you too. No more questions there?
Yep, just,
okay, all right.
Just saying, good question. All right, Dr. Jemsek, does anxiety and depression present differently in the Lyme disease population?
So you mean, I don't know if this means between patients, inter-patient, or whether it means just in the general population versus. So the threshold for stress is much lower in the Lyme population because of the organic encephalopathy. That's very clear. I think we all know that. The stamina for handling stress and the inclination to have stress-related issues is much higher in the population, given the same events, equivalent events amongst people who don't have organic encephalopathy. So the answer is absolutely yes.
There's one question that just came in, a little unrelated, but I do get this question a lot in my practice. So, Dr. Jemsek, do you commonly see whole families that have Lyme disease? Children, both parents?
Yes, we do. And I think we must have 150, 200 examples of that, where it's not always 100%, but it's like 60 or 70%. And then we go back in the lineage and ask about, say a middle-aged person or younger middle-aged person comes in. Well, how are your parents? Well, dad had ALS and mom has Parkinson's and rheumatoid, and it's just like, And so we do have a list of things in children that we see as harbingers of illness. So we made a little list, and they include things like excessive bedwetting, sleepwalking, obviously unexplained joint pain or muscle pain, or aching all the time, or neurologic tics, TICS. And Candace, our pediatric nurse practitioner, is also pointing out delayed menstruation or or very early menstruation, breast development that's excessive, things like that, which affect pituitary hypothalamic activity.
All right, next question. My teenager is struggling with Lyme and mainly stays in bed all day. Is it a good or bad thing to push him to exercise? Will that do more harm than good? So this is a tricky one because it obviously depends on how much your child is actually physically capable of doing. So if they can, take a walk or go swimming or, play basketball without it causing a huge crash and worsening of symptoms, then I would say, motivate him to exercise. It will make him feel better, most likely. But teenagers tell me all the time they hate when their parents bother them night and day to get out of bed. So maybe gently push them to exercise, or ask them to do something with you. Will you go for a walk with me, or do you want to, go kick a soccer ball around. So it's not always directly at them. You're trying to do it together. That tends to make teenagers feel a lot better because they feel attacked a lot of the time by their parents. So my answer is yes. I don't think it will do more harm than good unless they are truly, not capable of doing exercise. We don't want them to crash afterwards and then it takes a few days to, get back to where you were before. So I would say just be mindful of where your child is in this illness.
Yeah, it's like a fuel tank, the energy. It's they have smaller tanks and the fuel empties more quickly. So while the patient should be supportive, some kids, adults, not just kids, need more sleep. Mm-hmm. The brain just resets. You need that extra hour or two sleep. A lot of people do that before they get over clinical illness. They'll compensate. They'll go, we'll say, how come everybody's eating gluten-free? Let me try it. Oh, I feel better. And then they'll say, you know what? When I exercise and ride the bike 20 miles, I feel good. When I don't, I feel bad. What's that about? Or, I need 9 to 10 hours of sleep or else I have a bad day. Well, these are all signs of mm-hmm. compensation, and eventually, those compensatory things run out as the inflammatory meter goes beyond the ability to compensate.
An interesting question. If all I can do is crawl, how do you suggest I get exercise?
Well, I'd work with a therapist to see what you do on your back, whether you can do, knee to chest or, what you're able to do, whether it's some kind of band work. Mm-hmm. That's not my area of expertise, but crawling's not bad. It's not that easy to crawl. So you might be better off than you think you are. But no, seriously, I would say, okay, what can you do in the bed and mm-hmm. On your back with bands or just, using your own body or light weights perhaps. But I'd get some counseling on that because mm-hmm. I was going to mention before, I think it's important to stretch and tone and get the lymphatics moving a little mm-hmm. bit, So just lying in bed all day, even if you're so exhausted, if you get up and just stretch, mm-hmm. That's something and should be encouraged.
Mm-hmm. So really quick question that just came in. Are male and females, are males more likely to get Lyme than females?
Well, we see. I don't know.
That's a hard one.
So, it gets, if you're of the theory that it's a one tick bite, one disease thing, well, first of all, you're wrong. Are men more likely to be exposed to tick bites? Yes. But I have a whole different view of this illness, which I don't know that we've discussed before. I just think everybody's infected with a spirochete. And because it's so transmissible in so many different ways, I think vertical spread, mother to child. This is going to upset some of the people that don't like me when I say things like this. Mm-hmm. But the CDC is afraid to even study this. But I think knowing the spirochete, mother to child transmission, sexual transmission is mm-hmm. just easy. Mm-hmm. And so once it's in, it's in. Okay. So to the extent, so then we did a slide a few months ago that I presented in Denver that talks about what are the risk factors for illness. Well, at the top we put environmental, which is a great big who knows, but there's 1,000 new chemicals being made every year. Do you think that's good for us? I don't think so. When Monsanto makes a certain pesticide or does a certain thing, they can see the immediate effect, but they can't see the secondary, tertiary, and quaternary effects, the long-term effects and interaction in a complex environment, an infinitely complex environment. Number 2 would be lifestyle. Do you take care of yourself? Are you generally healthy? And third, and most important probably, is genetics. As far as who's going to get sick, and then you have to have the consortium infection. I think the most important of those, given the fact that the spirochete is ubiquitous, is Babesia. And if Babesia comes in, now you got a homewrecker, and now you're set up to have some problems, depending on your genetics and lifestyle and so forth, environment. But then you've got everything you need to become ill. And of course, we see all different patterns and modalities of illness. And a lot of it depends on those key features of how we live our lives and what we're exposed to.
Mm-hmm. So we have a time for a few more questions. We kind of touched base on this subject a little bit ago. Actually, we're going to switch gears a little bit. There was a few questions that we didn't get to on the past live stream, so let's focus on that for the last few minutes. All right, Dr. Jemsek, what do you think of the health benefits of Maca powder? Did I say that right? Maca? Mm-hmm. Maca powder. Yeah.
Well, I make my smoothie, and hopefully most of you have the formula. I didn't put it online. Well, actually, we did sort of, but it wasn't really correct from our book that we published. But it's components are coconut milk and oil and kefir. By the way, for the gut, fermented is good. So if you're one of the majority of people who can tolerate fermented food, the gut likes that a lot. It favors the beneficial bacteria, essential bacteria. So, but I make a smoothie, and I do have some maca powder. I don't use it all the time, but I put it in, and I think it's in the range of antioxidants. That's beneficial, but I don't think I wouldn't call it tier 1, but I think it's useful. I think with supplements, you need to get supplement fatigue, so you need to understand which ones are most important, are most helpful, and I really like the neuroprotective ones, and I would list those as curcumin, resveratrol if you don't have if you're not a female with a family history of estrogen-sensitive cancer, that is, quality fish oil, quercetin, I would say are tier 1.
This is a good question. How do you feel about Lyme patients wearing a mask if I can't breathe in it at all?
You're going to get St. Tony on my face here. Yeah, you know what? About 3 weeks ago, I walked down the hall without a mask, and I had an older, irascible patient woman said, "He's not wearing a mask. He must be for Trump." And I don't know. I think that, we got mask police everywhere now. I do wear a mask in the hall. Obviously, when I'm in my room here, I don't. I think there's a place and time to wear a mask. Not necessarily walking down the street where the next person to you is 50 feet away. That makes no sense to me. And it is hard to breathe. You've got an N95 especially. But I think the worst place, obviously crowded environments, like if you want to be in a riot and you want to join a riot and break windows and, burn things, then you shouldn't be too close to the other rioters. Just kidding. You know what? Elevators. Because we know the microparticles. The WHO for a while said, oh no, it's just the droplets that go 6 feet. Well, that's, sorry, wrong. So they're microparticles that spread 18 feet, folks. So the 6 feet distancing is just drive me crazy. So wear a mask in the elevator for sure. If you're walking down the street, I don't see the logic in that whatsoever. I want to know if people are aware of our little supplement cocktail that will protect you from extreme forms of COVID, because this is going to be around for a while. Hopefully the bumps will be smaller and smaller, but I knew we were in trouble when the south of the equator during their warm weather months, they were having outbreaks. I knew we were in trouble. So vitamin C, a gram twice daily, vitamin D3, 5,000 units, zinc, 100 milligrams, quercetin, 500 milligrams twice a day, with or without bromelain, I don't care, and nattokinase, 200 milligrams. This is on a webinar that I did, and I explained it. There's PowerPoint slides. I think it's about 8 weeks old, under AONM, Academy of Nutritional Medicine out of London. Now, if you're older, a much smaller person, you're going to take a half or even a third of these doses. And these are just broad general recommendations that I give to the people that are listening and my patients. And I have a handout for it, but I don't put it on my website, even though I'm actually talking to a few thousand people now. There's liability issues. So these are just broad general recommendations, guidelines, if you will. They're not standard of care. Thank you. That's my disclaimer.
All right, our last question before we end is, can you discuss low DHEA and why supplements may cause symptoms in the brain?
Well, I assume you're talking about DHE supplements, and so one of the things, DHE is a precursor to the sex hormones, so estrogen and testosterone. If you drastically raise your testosterone levels, you are going to have an impact on the brain. The most important, this doesn't come from me, this comes from a very good endocrinologist and weight loss expert, a very prominent person, said, you have all the hormones. I think testosterone is the most important in terms of brain function, body cell mass, energy, growth, cellular integrity, and so forth. Now, estrogen is obviously very important, and progesterone has a role. I don't know if this answers the question, but I'm guessing you're upregulating your testosterone quite a bit and maybe giving the brain a bit of a jolt. I do want to go through one more question real quickly. We don't have much time. Do you think there's a link between Lyme and high-functioning autism? And I just want to refer you to my good friend and, renowned, unequivocal expert on this, Dr. Robert Bransfield out of Red Barn, New Jersey. He's a psychiatrist, phenomenal writer, and published so many articles, and brilliant man. And he speaks on this. If you'll research Dr. Robert Bransfield, he speaks on all topics related to Lyme borreliosis, organic encephalopathy, and the whole range of psychiatric disorders. And he's an expert on autism. So Dr. Robert Bransfield, thank you.
All right, well, we are about done. I want to thank you guys all for your amazing questions, and please keep sending them. So when we do the live stream next month and the coming months, we will be sure to address them. So again, just thank you so much for signing on. We really appreciate it.
And I want to thank you as well. I want to thank Jules for guest hosting. You did a wonderful job, and
Thank you.
very much appreciate it.